at a topic of the modified Duke's criteria. So here, modified Duke's criteria, by that we mean the recent updated 2023 criteria, and let's look into it. Firstly, the modified Duke's criteria, we need to know there are two criteria. It has two components, that is the pathological criteria. So there is a pathological criteria as well as there is a clinical criteria. So here, if clinical criteria are used, a definitive endocarditis is defined. So it is defined by the presence of two major or one major plus three or three minor, or there can be five minor. So it can be two major, it can be one major and three minor, or it can have five minor. So now let's go in detail. So there is something known as the pathological criteria. So under this pathological criteria, first there is microorganisms. So first is the presence of microorganisms, and they are identified in the context of clinical signs of active endocarditis. Clinical signs of active endocarditis. So what does this include? So if you see, this includes, there is the vegetation, there is presence of the cardiac tissue, next there is an explanted prosthetic valve can be seen, or a sewing ring. Next there can be the ascending aortic graft, and this is with the concomitant evidence of the valve involvement. Next, there can also be presence of the endovascular, there can be presence of the endovascular, intracardiac, implantable, electronic device. So in short, it is known as the CIED. As well as it can include the atrial embolus. The atrial embolus. Next, so the criteria, it can include this or. So now we are going to see what is the other thing it can include. So first we saw it can be microorganisms identified in these contexts. The second one is the active endocarditis. That the active endocarditis. So they may be acute or subacute or chronic. So it may be acute, it can be subacute, or it may be chronic. So it is identified in or on one of the following. So what does it include? It can be due to vegetation, it can be due to the cardiac tissue, or it can be due to the explanted prosthetic valve or the sewing ring. Next, due to the same as we discussed, the ascending aortic graft, and with the concomitant evidence of the valve involvement. Next, the CIED, that was the endovascular intracardiac implantable electronic device, that is, we are going to write it as CIED, and also the embolus. And another thing to note is that the microbiology identified. So the microbiology identified, it is identified by the PCR. It is identified by the PCR and the amplicon and the metagenomic sequencing. Metagenomic sequencing. So this is in situ hybridization. Next, most important, we are moving on to, this was the pathological criteria. Next, we'll be looking at the clinical criteria. So what we discussed earlier, we will recapping. So in clinical criteria, for definitive endocarditis, we look for 2 major. So you can have 2 major, you can have 1 minor along with the 3, 1 major along with the 3 minor, or you can have 5 minor. So they are the categories, the criteria for diagnosing. So now we have the major criteria. So under major criteria, we have microbiology. So in microbiology, we look for the positive blood culture. So we look for the positive blood culture, and the major criterion can be met if one of the following conditions is satisfied. So you look for one positive condition in this. So you look for isolation of microorganisms commonly causing the infective endocarditis from 2 or more separate blood. So it is from 2 or more. 2 or more. So greater than equal to 2 separate blood. So you look for in case of separate blood culture sets. Next is isolation of microorganism occasionally or rarely causing the infective endocarditis. So you look for some occasional or rare organisms which cause, and this is in case of you look for the 3 or more. So in case of 3 or more blood culture test. So this was microbiology. Next we look at the positive lab test. So in positive lab test, this is the major criterion and it can be met if one of the following conditions is met. So in case of one of the following condition is met. So here there is a positive PCR. So we look for the positive PCR or other nucleic acid based techniques for specific microorganisms or any other nucleic acid based techniques, and this is for specific microorganisms. And what are the microorganisms included? So it includes the Coxiella burnetii. Next there is also the Bartonella species. Next comes the Trophorima whipple. Trophorima whipple, and these are from blood. These are from the blood. And the next point will be the Coxiella burnetii. This is the antiphase. The antiphase, that is Ig antibody titer. So this is nothing but it is greater than 1:800, or isolation from a single blood culture. So isolation from single blood culture. So now we are looking at the third point. So here at least one point should be favorable. So the third point is nothing but there is an indirect immunofluorescence assay, and this shows IgM. This shows IgM or the IgG antibodies. It shows the IgM or the IgG antibodies to the Bartonella Hensley or the Bartonella quintana. So this is with the IgG titer, and this is nothing but greater than 1:800. So this was about microbiology. Just to recap, we saw the positive blood culture and also the positive lab test. Okay, now moving ahead, we are going to go to a topic of imaging. So under imaging, we look for the ECG. So we look for ECG as well as the cardiac CT imaging. So what do we detect? We detect for an anatomical evidence. So we look for an anatomic evidence, and this is of the infective endocarditis, and this is the valvular leaflet perforation. So valvular or the leaflet perforation, and also the aneurysm. Next, there is also the abscess. There is abscess or the intracardiac fistula. Next, there can be, we look for the significant new valvular regurgitation, or we also look for a new partial dehiscence. So new partial dehiscence of the prosthetic valve. So next, we look for the something known as the FDG. So FDG, that is the PET or the CT imaging. So what is special in this? It is now recognized as a valuable imaging modality. So it is considered as a very important modality, and it is particularly in cases of the prosthetic valve. So it is in cases of the prosthetic valve endocarditis. In case of prosthetic valve endocarditis, that is in short, it is known as the PVE. So, or that is greater than 3 months of the cardiac surgery, and when the echocardiography is inconclusive. That is, the echocardiography is inconclusive. That is, you don't find it clear. Next will be going on to the surgical aspect. So first was we saw microbiology. Next was the imaging, where we saw the echocardiography, cardiac CT imaging, as well as the FDG PET CT imaging. Next, we are going to see the surgical. So here, in case of the surgical, there is a intraoperative evidence of, there is a intraoperative evidence. So there is a intraoperative evidence of the IE. What is meant by IE? It is nothing but the infective endocarditis. So such as we discussed this earlier as well, vegetations. Next, we also look for the abscess, then the valvular obstruction. Next, where the other definitive criteria are lacking. So the other definitive criteria are lacking. So next, we move on to we saw the major criteria. Next, we'll be moving on to the minor criteria. So under minor criteria, we look for some predisposition. So predisposition. So what is seen under the predisposition? So we look for any previous history of any infective endocarditis. Next, we also look for any presence of the prosthetic valve. Then the next point is previous valve repair, and then we also look for some congenital heart diseases, and more than the mild regurgitation. So more than mild regurgitation or stenosis of any etiology. So stenosis of any etiology. Next, there is also the endovascular cardiac implantable electronic device. So in short, we already saw this, it is a CIED. Then we also look for the hypertrophic obstructive cardiomyopathy, and also the history of injection drug use. So history of injection drug use. So this was about the predisposition. So next category, so A was predisposition, so now we move on to B. So B is nothing but fever. So by fever we mean a temperature greater than 100.4 degree Fahrenheit. So this was fever. Next we will move on to the third one, that is vascular. So let's repeat what we did. We saw the minor, the predisposition was done, the fever was done, now it is vascular. So under vascular there is a major arterial emboli. So we look for the major arterial emboli. Next there is also the septic. There is septic pulmonary infarcts. Next there is also the mycotic aneurysms. Next comes the intracranial hemorrhage. Next comes the conjunctival hemorrhages, and there can be purulent purpura, there can be Janway lesions, as well as the splenic and cerebral abscess. The splenic as well as the cerebral abscess. Next we'll move on to the next category. So vascular was done. So next one is the immunological evidence. So the immunological evidence. So under this immunological evidence, we look for the immune complex mediated. So immune complex mediated, the glomerulonephritis as well as the Osler nodes. We look for the Osler's nodes. Next, we also look for the Roth spots. We look for Roth spots as well as the positive RF. What do you mean by positive RF? It is the rheumatic factor. Next, we also look for the microbiological. And this is nothing but the positive blood culture for microorganism with consistent with infective endocarditis and not meeting the major criteria requirements. So it does not meet major criteria requirements. Next, there is also the PCR or the amplicon. So PCR or the genomic sequence evidence. So genomic sequence evidence and of the typical pathogen. So moving further, there is also imaging in case of the minor criterion. So what do we have in imaging? So under imaging, there is the PET or the CT evidence. And this is in less than 3 months. Of the cardiac surgery. Then we move on to the physical examination. So under the physical examination, there is a new auscultation. of the regurgitant tumor the regurgitant murmur, and this is when the ECG is unavailable. So this is when the ECG is unavailable. So this was about the major and the minor criterion. So there are some other important points to note is that the diagnosing the endocarditis. So this is rejected. This is rejected if an alternative diagnosis is established. So the alternative diagnosis is established. So this is when the symptoms, the symptoms they resolve. So the symptoms resolve and do not recur. So they do not recur. They resolve and they do not recur. And this is less than 4 days. And this is less than 4 days of the antibody therapy. Next, in case of surgery. If surgery. So if surgery or autopsy. So you look for any surgery or the autopsy. And this yields to no pathological or the macroscopic evidence. So there is no pathological or the microscopic evidence is absent. Evidence of the endocarditis. So this is in less than 4 days of the antimicrobial therapy. So this was totally about the modified Duke's criteria, and this is of the updated, that is a 2023 modified Duke's criteria for the infective endocarditis. So to learn and grow daily like this, please do subscribe.